sometimes they don't know who you are. So introduce yourself. Tap them on the shoulder. It took Dr. Sharon a second. You know, the second that he walked, I mean, I wasn't sick and an inpatient in the hospital, but it took him a second to connect with me. You know, just saying, hi, how are you? You know, is sometimes all that it takes. And then they relax, and you're going to get everything done quicker. Any other question? Yes.
One thing I struggle with in the office is with our noting system now, we're basically tied to the computer.
Right.
And I feel like the computer is just this huge barrier between us and our patients. And especially with the way some of the rooms are set up, we're kind of forced to face a different direction.
The other way, yeah.
Sometimes, rather than it being a desk and you could actually look at someone. Do you have any advice for getting around this necessity to have your notes and have good documentation, but also to get around that and actually talk to them?
So I've had doctors that just look at the computer, and how are you doing today? Okay, good. And I've had doctors who say, you know, I have to type the notes on the computer, but tell me how you're doing, and then I'll type. Tell me how you're doing, and then I'll type. So yeah, you might get dizzy, and I know that's your specialty, so you should have tips for yourself on how not to get dizzy. But, you know, you are going to be, not make me dizzy, you are going to want to, you know, eye contact. Have eye contact with your patient, and if you explain to them that you need to put everything in the computer, it's so helpful for a patient when you walk in, and the doctor already has all of your notes from every visit you've ever had to any hospital in the Bay Area in front of them. And patients do realize how helpful that is. So we do want you to put stuff in the computer, but making that eye contact and explaining to them first. Because literally I have had doctors who, you know, don't greet the person I'm with and just look at the computer with their back to me, and I'm talking to their back. And I don't want to talk to their back. Like, I don't say things. Yes?
One of the techniques that I'm wondering if it resonates with you is to turn the computer towards you. So, like, if you're going to look at a scan or something, include you in
Oh, definitely. Yeah.
Instead of making it wall.
Yeah, one thing that I didn't really mention, engaging your patient. So if your patient knows, like, for example, if I knew why they were doing those tests, other than I'm in a research hospital, it must just be research. If I knew that they were doing those tests to enact some sort of treatment to try to make me feel better, I would have been more engaged, and I would have been, I mean, I was pretty cooperative because I was, you know, practically comatose, but I would have been more engaged, and maybe they wouldn't have had a whole chapter in my book. But, you know, you got to engage the patient, because if they know why you're doing something, they're not going to panic, and they're going to want to help you. And you do want them to help you, because again, you want that cooperation from somebody who did not sign up to be there, and who does not want to be there, because you want to be there. Always remember, you worked hard to be there. They didn't. They probably worked hard their whole life to not be there, and they're there. So, does that answer your question? Okay. Any other questions? Okay, well, I'd like to invite you to, again, fill out the feedback form, and I'll be over at the table if anybody wants to take a look at the books and the other items that I have for you today, and thank you very much for your time.
That's great.
Thank you so much.
Thank you. That was really nice.
I'll give you a hug. Thank you.
Yeah, that was really something.
Fun.
Yeah, I enjoyed it. Yeah.
Oh, that's right, Grommet's back there. I'm like, where did Grommet go?
I'm Anna Meyer. I'm one of the pediatric ear, nose, and throat doctors.
Oh, perfect.
And I actually teach communication to providers here.
Oh, good.
I'm part of a national organization called the Academy on Communication in Healthcare.
Okay.
And we're actually looking for patients to become involved in the organization.
I would love to.
And see, I think you'd have a lot to teach.
I would, yeah. I'd love
us,
to.
and also
actually,
learn
on
from
the
us.
feedback form, it has a place to put your name and your email, so I'll definitely give you a call.
Okay.
And what was your name again?
Anna Meyer.
Anna. Okay. Great.
Nice
Thank
to
you so
meet
much.
you.
Nice to meet you. Hi.
Sorry, Nathan, good job.
Thank you. How are you?
Good. I wish I saw all of it.
That's okay.
It's for you.
Oh,
Much belated.
thank you.
For all the hard work for the letter of recommendation and just.
I have to figure out how to turn this off. I have no idea how to turn my mic off.
Oh, you want to just unplug it at least for now?
I have two of them on.
Is it underneath? You're sure?
Where's the other one? Is it up here?
It's right here.